Hey, come in. How are we doing today? Good, well, you made it through 2020, which is an achievement in its own right. Now, as is standard, we usually do a big thorough check at the start of the year. It's your annual physical exam, and we like to get it out of the way right at the beginning. And just make sure you're staying fit and healthy, which obviously is more important now than really it ever has been. I'm sure you'll agree. Also, we have a visiting eye specialist today. He's actually one of the lead optical experts in the whole country, and you will be seeing him for your eye portion of the exam. Sound good? Good, okay. Just before we get to that though, we have to go through some questions about your recent health, if you don't mind. Okay, let's get through these quickly. Have you experienced any recent changes to your health? Okay. Do you struggle with your breathing? That's good. Have you developed a persistent cough within the past few weeks? Good. Do you live on your own or with other people? Have you been working from home or do you travel for your job? Okay. Do you exercise regularly? Obviously a little harder with all the gymnasiums being closed. That's good. Okay, and about how much exercise would you say you get? So under 1 hour a week, 1 to 2 hours a week, 2 to 6 hours a week, or more than 6 hours a week? Okay, that's very good. More than me, really. Okay, that's the objective portion of the exam complete. So the questions. The next are all subjective, which relies on your accurately relaying how you feel about things, okay? So I'm going to give you some 1 to 5 questions, and you just kind of put about what you're feeling on the scale. So on a scale of 1 to 5, 5 being very satisfied, 1 being very dissatisfied, how happy are you with the amount and quality of sleep you're getting at the moment? Okay, it's actually improved since last time, that's good. It's not perfect, but it's moving in the right direction. On a scale of 1 to 5, 5 being extremely stressed and 1 being not stressed at all, how much stress do you experience in an average week over the past few weeks, few months? It's not exactly an easy question, but just an average. Okay, I'd say that's within acceptable parameters. And how would you rate your overall mood recently? So 5 being entirely happy, satisfied, 1 being severely depressed. Yeah, okay. Also moving in a positive direction. Really happy to hear that, actually. That's terrific. Okay. Just a quick temperature check and a little bit of hand sanitizer, and I'll pass you over to the eye doctor. So, if you could just open wide, I'm going to pop this under your tongue. And just lift out your tongue. Let's pop this out. Good. Oh, that's good. You don't have a temperature or anything too outside of normal boundaries. I'm just going to pop a little bit of hand sanitizer on. If you could just give me your hand. Good. Just rub them together. Very good. That's great to hear. I'd like to check over the rest of you now, if we can. And I think we're gonna continue on with some of your senses, alright? We're gonna start with your olfactory, since this is your sense of smell, okay? This is the fun one. Everybody likes this one. Okay, so I'm gonna give you a series of bottles, scented, and you're not gonna peek at them. You're gonna keep your eyes up here. And these are familiar, normal, common smells. So just give your best guess as to what they are, okay? I'm going to cover the label so you can't see them. Okay, first one, just have a deep breath. It's common in baking. Yes, that is almond. Okay, next one. Okay. Okay. Big inhale. Yes. Of course, that's vanilla. A little overpowering on its own, really. Okay. Another very common smell. Should be familiar. Deep breath. Yeah, well, peppermint, mint, same thing really. Well done. Okay. This is the last one. And what do we think this is? Good. Cherry. My least favourite of all the fruits. Yeah. Good, that's a 4 out of 4. Good start. Alright, let's just check check around your glands and some of the muscles in your face, okay? I'm just gonna check around here, okay? So, pop your head up a little bit. Okay. And just do it. Don't feel any swelling, no inflammation, that's very, very good. Okay. Just gonna check around your lymph nodes here. Do you get tonsillitis, anything like that quite regularly? Yeah, okay. It's rather nasty. I've had several run-ins with that. Okay, that looks fine. Let's go check over your face muscles, okay? Just pulling this up. Okay. So if you could furrow your brow into a frown, like this. Very good. Okay, now I'm going to try and push it up. I need you to push against me, okay? Resist, 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 resist. Keep resisting. Good, okay. Let's do the opposite now. I'm going to try and push down and you're going to raise them up. Okay. Resist, 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 resist. Good. Well done. Doing very well. Let's just try your eye muscles. That's different to your eyes. We know they're working, so squish them shut. I'm going to try and open them, okay? And don't let me. So squish them. Don't let me open them. Don't let me open them. Don't let me open them. Very good. Well done. Now I'm going to try and shut them. So you need to keep them open as wide as you can. Okay, I'm just going to squish down now. Very good. Okay, now scrunch your nose up like this. Okay, good. Now flare your nostrils like this, as if you're angry. Okay, good. And now puff out your cheeks like a puffer fish. Good. And now suck them in like you're a runway model. Good. No pain, anything in the jaw. Okay, just clamp your jaw together. Okay, and open it wide. Okay, good. Everything working perfectly there. Let's move down to your shoulders, arms and your legs. Just checking your basic resistance strength, making sure there's no excessive muscle atrophy or excessive weakness. You really should be able to push against a minor bit of pressure. So I'm going to push your shoulders down. I need you to shrug them up, okay? And don't let me push them. Ready? Okay, don't let me push them, don't let me push them, don't let me push them, don't let me push them. Once more time. Okay, good. If you could put your hands together like this, I'm going to press them together. I need you to push outwards, okay? Ready? Push against, push against, push against, push against. Very good. Very good, okay. Now I'm going to try and pull them apart, and I need you to push them together, alright? Ready? Resist. Resist. Very good. Seems to be fine. Okay, now let's raise them up like this, and I'm going to try and push them down, okay? Raise them up. Okay, good. Now I'm going to take all of your wrists and I'm going to try and pull them up. I need you to squish them down by your side, okay? Ready? Okay, good. It's going to move on to your legs now. I'm going to push against your shin. I'm going to try and move it back towards you. I need you to kick it out, okay? So push outwards. Start with the right one, your left. Ready? Resist. Push against. Good. Same on the other side. Push against. Good. That's great. Now I'm going to try and pull them out. I need you to pull them back in, okay? So again, we'll start on this side. Okay, just try and pull it in. Pull it in. Good. And over here. Okay, good. Nearly done. Lastly, I'm just going to grab your foot. I need you to push downwards as if you're accelerating in a car. And I'm going to pull. Alright? And push down. Push down, push down, push down. Okay, good. And same on the other side. Very good. Well, it certainly seems like strength is not a problem for you. Very good. I myself feel I've got horrendously out of shape the past few months. So you're doing better than me. Well done. Okay. Now we're just going to check how well you can differentiate between sensations, okay? So, I've got an object here. This is a blunt end, and this is a moderately sharp end. It's not going to hurt you. I'm not going to stab you, don't worry. Now, I need you to close your eyes, and I'm going to put this at various points over the face, okay? And I need you to tell me whether it's the sharp side or the blunt side, alright? Good. Now, eyes closed. Now, is this the sharp side or the blunt side? sharp side or the blunt side? Is this the sharp or blunt side? Sharp side or the blunt side? Is this the blunt side or the sharp side? Is this the sharp or blunt side? Sharp or blunt side? Sharp or blunt side? Is this the sharp or blunt side? Sharp or blunt? Good. Very good. Let's just try the same but with your hands. Let's pop this down. Okay, so hands out in front of me. Okay. Again, no peeking. Just keep your vision centered. Okay. So, is this the sharp side or the blunt side? Sharp or blunt? Blunt or sharp? Sharp or blunt? And again over here, sharp or blunt? Good. Sharp or blunt? Sharp or blunt? Up here, sharp or blunt? Good. You appear to have full sensitivity in your hands and on your face, that's great. Got every single one correct. If there was nerve damage there or any injury that might cause nerve damage, then sometimes it manifests as dulled sensations or not being able to perceive different sensations. So that's a good sign. Okay, now just going to have a look inside your ears with my light first of all, and then we're going to do a quick hearing test. Now, do you listen to music regularly? Do you wear earphones? Yeah. Do you have it loud? It's fine, we all do it, but as we get older we need to look after our hearing. Shouldn't bother you so much as you're young, but one day it will. Okay. So, I'm just going to come around the side of you just here and have a look in the ear. Okay. This looks good. Yeah. Okay, good. I don't see any build-up of wax or tissue or grime or dirt. You keep good care of your ears, that's great. Okay, good. This looks great, yeah, absolutely fine on this side. That's good. Let's have a look over the other side. Okay, just gonna shine this in here. Again, no buildup of excess wax. Ears appear to be properly cared for and cleaned. That's good. Don't see any redness or evidence of a perforated drum. That's good. Okay. A healthy amount of wax is fine, but when it starts to get excessive, that's when we may need to look if there's a problem, but it doesn't seem like there is. Good. Happy with that. Appears to be fine, at least from what I can see on the outside. Just record that. Okay. Now, a quick hearing test. I'm gonna hold my hands up either side of your ears. I prefer you to close your eyes. and I'm going to make noises, just little hand noises next to one ear, or both ears, or no ears. And I need you to just point or say left or right for whichever ear you hear the noise next to you, okay? Okay, now ready? Good. Yep. Okay. Good. And again. Good. 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 Doing very well so far. Please try to ignore the seagulls. One of the downsides of having a medical practice on the seaside. It's both correct. Over here. Over here. Both together. Very good. Well done. Doing very well there. That's the hearing test complete. Okay, let's just pop this down. Okay, now just going to listen to your lungs and your breathing. Just going to make sure there's no obstruction. I'm going to listen all around here and then go around to the back. I'm going to do a series of breaths and deep breaths in, okay? I'm sure you know the drill by now, so just gonna come in just here. Okay. Alright, I need you to breathe 3 seconds in and hold for 2 and then 3 seconds out, okay? Just a cough. Okay, one more. Okay, now I need you to take a big breath in and then hold it. Okay. And breathe out. And again here. Hold it, hold it, hold it, and out. Okay, I'm going to come around the back now. So just around here. Okay. 3 in, hold for 2, out for 3. Good. Over here. Good. Down here. Here, up here. Okay, now I just need you to cough again. Once more. Good. Don't hear any obstructions there. So far, so good. Appear to be nice and healthy, which is terrific. Okay, we're nearly there. I'm gonna quickly just check your pulse, your heart rate. You can do this here or on your wrist, whichever you prefer. Okay. Now try to just breathe and relax. Breathe normally. between 40 and 50. Resting heart rate is good. It's actually very good. If it was higher than 90, you probably should be slightly concerned, but nowhere near that. Okay, lastly, I am just going to check the inside of your mouth. I'm just going to do this with the light, okay? So, if you could just open wide, please. Okay, and say ah, ah. Have you had any recent dental work done? Okay, it seems to have healed well. Good. Okay, very good. You're doing very well. Okay. Well, I think that appears to be everything. I'm going to wait for the data from Dr. G to come over, and then I can combine that with what we've just done today, and we'll give you a full breakdown of your overall health. But from initial findings, seems positive. Nearly everything has moved in the right direction since last year. Very happy to see that your mood has improved. It's terrific. And I'd maybe like to bring you back in 4 to 6 months' time to discuss the sleeping and see if we can't sort that out. Maybe try some home remedies before we try medication. It can be equally, if not more, successful. Brilliant. So, I shall see you in a few months. Please do take care of yourself, and thank you so much for coming in. Brilliant.